It's 20 minutes to 8 on breakfast. And as we were discussing just earlier there with Michelle, the Gillard government will try again today to cut the cost to taxpayers of the 30% rebate on private health insurance. Health Minister Nicola Roxon will introduce legislation applying a means test on health fund members earning more than $80,000 for singles and $160,000 for families. And all in all, it adds up to a $2.8 billion revenue save if the government gets it through, or a $2.8 billion hole in the budget if it doesn't. Health Minister Nicola Roxon joins us now in the Parliament House studio. Minister, welcome to breakfast.
Good morning.
Before we get to the means testing of the private health insurance, Minister, can I ask you as a member of Cabinet, can you confirm a starting price for carbon will be $23 a tonne?
Look, nice try, Fran, but as you know, this will be announced on Sunday. That's when all of the details will be released, and I'm certainly not intending to give you some sort of scoop before then.
It seems others have the scoop, but it's not wrong, that figure?
I'm not going to comment on it. On Sunday, all of the details will be made available. That's when there will be a proper briefing, lock-up, all of the materials and details will be released, and that's when that question will be answered.
OK, just to stay with carbon for a moment, Tony Abbott was at the National Capital Private Hospital in Canberra yesterday as part of his anti-carbon tax campaign, and he said a carbon price would mean $60,000 to $70,000 a year increase in the hospital's electricity and gas bills. How will the health sector fare under a carbon tax, and will they be compensated in the same way as households will be compensated?
Well, obviously, all of the details, as I've said, will be released on Sunday. But I make this point to Mr Abbott, which he seems to have missed. Our health reforms make a clear commitment to meeting the ongoing growth costs to the hospital system. We now will share in 50% of the growth costs into the future for health. And that is billions of dollars of investments, something that Mr Abbott is pretty familiar with because he ripped $1 billion out of the public hospital system.
Sure, but what's that got to do with the cost of a carbon tax?
Well, what it makes clear is that we are sharing the responsibility for the growth in costs, and I must say a very small part of which is related to any of the energy costs. The big costs in health, the drivers, of course, are actually the workforce, the doctors, the nurses and other health professionals. We are stepping up to, through our health reforms, not only training more of those health professionals, but also sharing the cost as the cost of hospitals grows into the future. That's part of our long-term reforms that required extraordinarily hard work that Mr Abbott was never prepared to put his shoulder to the wheel to deliver.
Sounds like a confirmation, though, that hospitals will have increased electricity and gas bills and not necessary compensation to deal with them.
Well, I'm not going to be verbaled, Fran, on this. I've made quite clear that the government is announcing, as I think the Prime Minister, the Treasurer and everyone else that has been asked has made clear, those details will be available on Sunday.
OK, Minister, let's go to the bill now you're introducing into the reps again today to means test private health insurance, the private health insurance rebate. If you can't cut a deal with the independents, the government would be facing its first significant defeat on legislation since the election. You do have the Greens MP Adam Banton's side. You need another 3 votes from the crossbenchers. Do you have the numbers to head that off? Do you know yet?
I don't have those numbers in my pocket today as we speak. It's going to be a big challenge. We have had this twice before the Parliament and it hasn't been successful. So I don't underestimate the big challenge that we have. But there are 2 key things that we're talking to the community and to the independents about. One is this is about fairness and equity. This is only changing the rebate for those on very high incomes, and it's reducing slightly the rebate for those on the higher end of middle incomes. But 8 million Australians will not be affected at all by this change, 8 million Australians who currently have private health insurance. So this is about making it fair and equitable, making sure that, you know, your ordinary taxi driver, nurse, secretary doesn't have to pay for my private health insurance or a millionaire banker's private health insurance. But the second point is that if we don't pass this legislation, the fastest growing component of the health budget is the private health insurance rebate. And in just 40 years, these changes, if they're not made, will cost $100 billion to taxpayers. That's a lot of money that we can use for other important health initiatives, and we simply have to be able to keep under control some of the fast-growing components of the budget.
What signals are you getting from the crossbenchers? We spoke about this some months ago. Presumably you've been lobbying them or talking to them intently about this. Are they getting closer to being persuaded by those arguments? Because they would be under a lot of pressure about the rising cost of living pressures. That's a real political hot button at the moment.
Well, we're talking with them, and I'm not going to make announcements or reveal those discussions. I think it is fair to say, and I don't think I'm compromising or releasing any confidences, that they are all absolutely engaged, that they do understand why the government wants to take this action. Most of them represent electorates that have fairly low incomes, so the vast majority, the overwhelming majority of their electorates would not be affected in any way by this change. In fact, the change would ensure that the vast majority of people that have private health insurance in their electorates would be able to continue to have the full support. And of course, that's part of making it sustainable. But ultimately, there are pressures. I mean, the health insurance industry are out there campaigning very heavily, as is the Liberal opposition. And I think that this still has a little way to go.
If the legislation fails for the third time, that's a $2.8 billion hit to the budget. What's the consequences of that for the government's projected surplus by 2012-13?
Well, the consequences are serious. We're not conceding that this will not be passed, but we believe that there is other, important work still to be done. But you do need to remember this is a measure that has been introduced twice. It's been in our budget twice. We've had to accommodate it not being passed before, but that presents very difficult decisions for us when we know that there are a long line of important health requests, whether it's new drugs, whether it's investments in doctors and nurses, whether it's investments in hospitals, whether it's looking at other initiatives that the government wants to be able to take even outside the health portfolio. But there's a little way to go on this yet. We haven't had a final position from the independents, and I certainly don't want to put words in their mouth this morning.
It's 13 to 8 on Breakfast. Our guest this morning is Federal Health Minister Nicola Roxon. Minister, we've spoken on many occasions about the health reforms you've been trying to negotiate with the states over the past few years. One of the big headline changes in hospitals was a new guaranteed 4-hour waiting time target for casualty wards. Have you caved into the premiers, and are you dumping that target now for some hospitals?
No, we are absolutely not dumping that target. The 4-hour rule for emergency department remains. In February of this year, when the Prime Minister was able to negotiate a deal with every state premier, one of the things that was agreed, that was contestable between the parties, was that how you would actually implement this rule and how you would implement the elective surgery commitments as well. We all agreed to take the politics out of that, to appoint an expert panel, to get them to give us advice about how best to protect the patient and deliver better access for the patient, and we all agreed we would accept their outcome. This is now what they've come back with. They've said it's better to introduce it hospital by hospital rather than triage category by triage category, which they thought was far too messy. That took advice particularly from the West Australians who have already implemented this rule. So I think this actually strengthens the deal. We have more confidence that we'll have clinical support to be able to deliver this change, and that's a good outcome for patients.
Well, for patients though, what can you tell them? When will all hospitals have to abide by this 4-hour target?
Well, it gets phased in over the next 4 years, the period of this agreement. The 4-hour rule means that people need to be seen or admitted within that time. And it's the exception, the sort of change, if you like, is there was always an acknowledgement that there would be clinical circumstances where it was not appropriate to move somebody within that time. Someone recovering, for example, from a drug overdose, it might take 6 hours, no purpose in admitting the person, but you obviously can't leave them to get out of the emergency department before they have properly recovered. These are real examples that emergency physicians give to us all the time.
Okay.
So there is a change to say we've got to be aware that there are some clinical situations where it isn't appropriate, but in all the other cases we need to stick to this rule.
And Minister, just finally on another issue, a story we've been following here on Breakfast, the Queensland Government and the Commonwealth are involved in a funding dispute over TB clinics in Torres Strait, which means the clinics are set to close from October. Now, TB and public health specialists in Australia have warned that the closure of these clinics will cost lives of the Papua New Guineans who've sought help, and also increase the risk of multi-drug-resistant TB infections here in Australia. The Commonwealth's own TB advisory group has the same message. Are you playing with Australian lives by refusing to provide more funding to keep these clinics going?
No, I don't believe that that is a correct way of putting it. We think this is a very serious problem as well, Fran. We've actually committed $43 million, a massive new investment, in actually supporting Papua New Guinea to be able to have a proper treatment process themselves in Papua New Guinea. And every public health expert agrees that the best way to treat this is to have an effective regime in Papua New Guinea. Now, we haven't been able to get that before, and that's why the Commonwealth has supported the clinics in the Torres Strait. We're still committing the $4 million that has previously been provided. But this is about a transition, and I have actually, as recently as yesterday, spoken with the Foreign Minister to say, look, we do need to look at a way to make sure that people are protected as we transition from providing these services when people come across the border to providing them in their own country where they desperately need this health service for a much broader range of people, some of whom never make it across the border.
So that's a guarantee that we won't close these down, we'll phase them down till they're up to standard in PNG?
Well, it's a guarantee that I am working closely with the Queensland Government and with AusAid to see if there's any extra support that's needed while this transition is made. But we won't resile from the fact that we think it's best to be able to provide good, strong health services in Papua New Guinea, and that's why we're making this very big commitment of $43 million.
Okay.
Our commitment previously was the $4 million in the Torres Strait for these clinics, so you can see it's a scale of 10 times what we have been committing, but it does take some transition, and I think it's a serious problem, and it's why I've been engaged with the Queensland Health Minister to see if there's a better transition arrangement we can put in place.
Minister, thank you very much for joining us.
Thank you.
Federal Health Minister Nicola Roxon. It's 8 minutes to 8.